Good morning, everyone, especially to Mr. Bilbao. And I am Erica Faith Sidalit, and today I will be presenting to you our topic about the bronchogenic carcinoma. So, the objectives. After the discussion, the BSN 3M students will gain knowledge and a positive attitude towards the care of patients with bronchogenic cancer. Also, they will be define what is bronchogenic carcinoma and identify its risk factors and manifestations. Also, they will be discover the physiologic process of bronchogenic cancer, classify the different types and stages of bronchogenic cancer, and provide the necessary nursing interventions and treatment for patients with bronchogenic cancer. So, what is bronchogenic carcinoma? So, bronchogenic carcinoma, aka a lung cancer. So, this bronchogenic carcinoma is a malignant neoplasm of the lung arising from the epithelium of the bronchus or the bronchiole. So, this bronchogenic refers to the origin of the cancer, specifically the bronchi or the air passages, or the bronchioles, the smaller branches of the bronchi in our lungs. So, this malignant neoplasm indicates a tumor that is cancerous. It means that the cells have become abnormal and can grow, spread uncontrollably. So therefore, bronchogenic carcinoma is a type of lung cancer that starts in the lining of the bronchial airways. And usa pa sad, ang one risk factor mo gud ani sa lung cancer kay ang paggamit nato og tobacco. So naa jud tay makaingon jud ta na natay possibility nga makadevelop ta og lung carcinoma. So for the pathophysiology, uh, bronchogenic carcinoma tends to form an intraluminal mass which may partially or completely obstruct the bronchus. So the neoplasm also may compress or invade local structures such as aorta, esophagus, superior vena cava, or cervical sympathetic chain. This bronchogenic carcinoma often grows within the bronchial lumen, which is the hollow space inside the bronchus. So, this creates a mass that can partially or completely block the airway, and this blockage can lead to difficulty breathing, such as dyspnea, and other respiratory symptoms. So, the severity depends on the extent of the blockage, and also the tumor can also press against or grow into nearby structures, causing a various complication such as compression sa ato ang aorta, kay ang main artery manggod nga nag-carry og blood gikan sa ato ang heart kay maka-cause og pression ang blood flow sa ato ang blood flow kay maka-cause og kanang what we call it, chest pain, and also can cause high blood pressure. Then, sa esophagus sad, kay makakause pod siya og kanang difficulty swallowing and painful kay tungod sa kanang naay nahitabo nga compression. And also sa superior vena cava, ang large veins ang large veins nga nag-drain sa blood from the head and upper body kay naay blockage by the tumor and can cause a facial swelling like neck swelling and even vision problems. Also sa cervical sympathetic pod, this chain of nerves controls many involuntary functions like kanang mag-sweating ka and pupil dilation, sorry for that. So compression can lead to Horner's syndromes, a group of symptoms involving drooping eyelid, also constricted pupils, and decreased sweating on one side of the face. Next is the bronchogenic carcinoma may present with a variety of clinical manifestations, but the major findings are cough, weight loss, chest pain, and dyspnea. So these neoplasms also have the capacity to secrete hormones or hormone-like substances, which are a variety of clinical effects. So for this, some bronchogenic carcinoma can secrete hormones or hormone-like substance. So this can lead to additional symptoms depending on the specific hormone na nag-involve og like mga example like ectopic ACTH syndrome that can cause Cushing syndrome with symptoms like weight gain, high blood pressure, and muscle weakness. So, napod tayo paraneoplastic syndromes nga these are diverse group of symptoms that cause by a substance released by the tumor and which can affect the various organs and systems. So na-include na po diya ang ato ang ano like hypercalcemia, ang pagsaka sa ato ang calcium levels, also sa ato ang SI SIDH syndrome or the what we call the syndrome of inappropriate antidiuretic hormone and clubbing also which is the enlargement of the fingertips. So next is the classification of bronchogenic carcinoma. So narito do ka classification ani ang ato ang small cell lung cancer o ang ato ang non-small cell lung cancer. So mag-start ta aning small cell lung cancer. It is most aggressive, less common, often grown quickly. It is also associated with cigarette smoking and is usually treated with chemotherapy. Kaning most aggressive sino kay it is known to be most aggressive form of lung cancer due to its rapid growth and spread. And less common po siya but often grown quickly kay despite sa iyang aggressiveness, ang atuang small cell lung cancer kay less frequent lang siya compared sa atuang non-small cell lung cancer. And it is also associated with cigarette smoking that is usually treated with chemotherapy kay almost mga cases sa atuang small cell lung cancer kay is strongly linked sa atuang paggamit og cigarette like mga cigarette smoking like making it a significant risk factor. So naritay ka ng types of small cell lung cancer. So mo ni atong small cell carcinoma and mixed small cell or the large cell cancer or what we call the combined small cell lung cancer. So this small cell carcinoma mo ni ang type of cancer nga nag-appear in a various parts of the body but most often nag-occur ni siya sa tuwang lungs. So it can overgrow and spread to other organs. About 10 to 15% of lung cancers are small cell carcinoma. So smoking tobacco is the most significant risk factor gid ani nga makadevelop ka. So next is the mixed small cell. I-define ni siya pod sa ato ang WHO nga small cell carcinoma siya but combined with an additional component and also consisting of any non-small cell histologic type including sa ato ang adenocarcinoma, squamous cell carcinoma, and large cell neuroendocrine carcinoma. Ang atong next ani kay ang non-small cell lung cancer. More common grows slowly. This type of cancer usually grows and spread to other parts of the body and more slowly than small cell lung cancer does. So, kaning non-small cell cancer kay this type of cancer usually grows and spread to other parts of the body more slowly than a small cell lung cancer does. Then naapod tay 3 different types of non-small cell lung cancer. Mo ni nga ang adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Then ang ato ang adenocarcinoma. It is a form of non-small cell lung cancer and it is often found in an outer area of the lung. So, pwede po siya ma-develop in the cells of epithelial tissues which line the cavities and surfaces of the body and form glands. So this adenocarcinoma belongs to the broader category of non-small cell lung cancer which is grows and spreads slower than a small cell lung cancer. So these adenocarcinomas are typically found in periphery of the lung and also near the outermost layer called the pleura. So this contrasts with a squamous cell carcinoma and another common NSCLC type which often arises in the central airways. So these adenocarcinomas develops in the epithelial cells which are thin, flat cells and also various surfaces and cavities within the body. So these cells also form glands which secretes fluids or other substances. Next na to ani kaya nga to ang squamous cell carcinoma. It is a form of non-small cell lung cancer that is usually found in the center of the lung. So next to an air tube of the bronchus. So this type of lung cancer most closely associated with cigarette smoking. So SCC also tends to grow more slowly than other types of NSCLC. So it is often diagnosed at a later stage due to its central location, making an early detection more challenging. Also, treatment options for SCC vary depending on the stage and other factors, but typically involve like such as surgery, radiation therapy, and or chemotherapy. Ikatulo na to kay ang ato ang large cell carcinoma. So it is a form of non-small cell lung cancer that occur in any part of the lung and tends to grow and spread faster than adenocarcinoma or ang ato ang squamous cell carcinoma. So this LCLC is a diverse group of tumors which with various subtypes and also each with its own unique features and treatment option. So due to its rapid growth, the LCLC is often diagnosed at later stage, making treatment more challenging. So despite its aggressiveness, ang atong LCLC can be responsive to a certain treatment and approaches including surgery, chemotherapy, and radiation therapy. So now let's move on to the stages of bronchogenic carcinoma. So there are three factors that are used to determine the lung cancer stage. So we use the TNM, or T stands for tumor, like the size and location. So does it affect surrounding tissues or the organs? Also for RN, that stands for the regional lymph nodes involvement. And though question na to ni kay does the malignancy spread to any lymph nodes nearby? So for the M, uh, it is focuses on the metastasis status. So metastatic status refers to which organ or the cancer has spread. So mga question taniga, has the cancer spread to other parts of the body or distant organ like the brain, bones, or other lungs? So for our NSCLC, stages that range from 1 to 4 usually expressed in Roman numerals like 0 through 4. So the lower the lung cancer stage, the less the cancer has spread and the better prognosis. So stage 0, which is the carcinoma or the tumor in situ. So non-small cell lung cancer is an early stage of lung cancer that is only in the top lining of the lung or the bronchus and has not spread. So this stage 0 is often discovered through screening tests like low-dose CT scans, which are particularly recommended for high-risk individuals like smokers or those with a family history of lung cancer. And due to its early stage 0 is highly curable. So treatment typically involves minimally invasive procedures like surgery or laser ablation to remove the abnormal cells. So early diagnosis and treatment of stage 0 significantly improve the chances of the successful outcome. For the stage 1, so non-small cell lung cancer is divided into two sub-stages, so 1A and 1B. So based on the size of the tumor, stage 1A is the cancer affects the lung only, with a tumor that measured 3 cm or smaller and has not spread to lymph nodes or other areas. So, stage 1 is often considered a highly treatable form of NSCLC due to its early detection and limited spread, and also treatment option for stage 1A typically involves surgery to remove the tumor, with or without additional therapies like radiation therapy or chemotherapy. So early diagnosis and treatment of stage 1A is significantly improve the chances of a successful outcome and long-term survival. So for the stage 1B, there are instances where a lung tumor is bigger than 3 cm but smaller than 4 cm and has not spread to any lymph nodes. So in other cases, the lung cancer tumor is 4 cm or less and satisfies at least one of the following specifications. So, such as the cancer has reached the main bronchus, the cancer has reached the innermost tissue that wraps around the lung, and also either a portion of or the entire lung has collapsed or has pneumonitis. It is a condition in which the lung becomes inflamed. So for the stage 2A, the lung tumor is smaller than 5 cm, but larger than 4 centimeter and has not metastasized to the lymph nodes. So we can say that the cancer has reached the main bronchus but not the carina. Also, the cancer has reached the innermost tissue that wraps around the lung. Either a portion of or the entire lung has collapsed or has pneumonitis. Stage 2B. The lung cancer tumor measures 5 centimeter or smaller and has not reached and has reached lymph nodes located in the same area of the chest as the original tumor, typically lymph nodes in the lung or close to the bronchus. So we can say that the cancer has reached the main bronchus but not the carina. The cancer has reached the innermost tissue that wraps around the lung. Either a portion of or the entire lung has collapsed or has pneumonitis. So for the stage 3A, the cancer has reached the lymph nodes in the same area of the chest where the original tumor was found, typically the lymph nodes near the bronchus or in the lung. So we can see that the tumor is larger than 5 centimeter but smaller than 7 centimeter. So at least one additional tumor has formed in the same part of the lung where the original tumor was found. So stage 3 of the NSCLC is the cancer has reached at least one of the following. So the wall of the chest, the inner lining of the chest wall, the tissue that lines the outside of the sac around the heart, and the nerve controlling the diaphragm. Stage 3. In other cases, the cancer may have reached the lymph nodes in same area of the chest as the original tumor, and typically the lymph nodes near the bronchus or within the lung. So the lung cancer tumor is larger than 7 centimeter. At least one additional tumor has formed in a different lobe or different part of the lung that uh, than where the original tumor was detected. Also, the lung cancer tumor is any size and has reached the trachea, carina, or the esophagus, among other parts of the body. For the stage 3B, the lung cancer tumor is 5 centimeter or smaller, and the cancer has reached the lymph nodes above the collarbone in the same area of the chest as the original tumor or lymph nodes on the other side of the chest. So we can say that the cancer has reached the main bronchus but not the carina, and also the cancer has reached the innermost tissue wrapping around the lung, or either a portion of or the entire lung has collapsed or has pneumonitis. For the stage 3, in other cases the lung tumor is any size and has reached the lymph nodes on the same size of the chest. As the regional tumor, typically the lymph nodes near the aorta of the heart, the trachea or where the trachea splits into the bronchi. So number 1, at least one additional tumor has formed in the same or a different lobe of the lung as the original tumor. Also, the lung cancer tumor has reached the wall of the chest and the inner lining of the chest wall and the diaphragm or the nerve that controls the diaphragm, among other places. So for the stage 3C, the lung cancer tumor is any size and has reached the lymph nodes on the same size or the opposite side of the chest. At least one additional tumor has formed in the same or a different lobe of the lung. Also, the lung cancer tumor has reached the wall of the chest and the inner lining of the chest wall, also the diaphragm or the nerve that controls the diaphragm, among other places. So for the stage 4A, the lung cancer tumor is any size, may have reached the lymph nodes. Also, at least one tumor has formed in the lung opposite to where the original tumor formed. And number 2, the cancer has reached the sac around the heart or the tissues that wrapping around the lungs. Also, the cancer has spread to fluid surrounding the heart or lungs. And also, the cancer has reached an organ far away from the lung, such as the brain, liver, or our kidney. So for the stage 4B, the cancer has reached various places in at least one organ far away from the lung. So now let's move on to the small cell lung cancer stages. So we have two stages here, the limited stage and the extensive stage. So we have here the limited stage and extensive stage. So lung cancer is only in one lung with or without spreading to the lymph nodes in the mediastinum, area in the chest between the lungs. Also, this limited stage lung cancer offers a better treatment options and prognosis compared to more advanced stages where the cancer has spread beyond one lung or to distant lymph nodes. So knowing this stage helps to determine the best course of treatment, which includes surgery, radiation therapy, chemotherapy, or combination of these approaches. So early detection and diagnosis are crucial for maximizing the chances of successful treatment in limited stage lung cancer. And also extensive stage. So this extensive stage lung cancer has spread to tissue outside of the original affected lung, like the opposite lung or the distant organs. So the cancer has spread to tissue outside of the originally affected lung, like the opposite lung or the distant organ. So this the explanation for this is the cancer has spread beyond the initial lung also it originated from. So this signifies a significant progression and wider involvement of other tissues. Gotcha. So the cancer has crossed over the affected the other lung, indicating advanced local spread. Also has metastasized to distant organs like brains, bones, liver, or other sites beyond the chest. That signifies the most aggressive form of lung cancer. So let's move on to the assessment and diagnostic findings. We have here the assessment and diagnostic findings. So clinical signs and symptoms, the persistent cough. So this is a common symptoms often lasting for a weeks or months. So it can be dry or productive, often with hemoptysis or coughing up blood. So this can be a sign of advanced disease, but not as always, even small amounts of blood can be concerning. Next is the shortness of breath or wheezing. It can cause also by the tumor blocking airways or fluid build up around the lungs. Also, we have your chest pain that may be localized or radiate to the shoulder or back. Also, we have here unexplained weight loss, fatigue that is another common but non-specific symptom associated with various conditions, including the lung cancer. So, an excessive fatigue can interfere with daily activities, needs to be addressed. Next is the recurrent respiratory infection. So, people with lung cancer may be more susceptible to respiratory infections like pneumonia and bronchitis. So, next is we have here the assessment. So, we have here the chest x ray. Using chest x ray, it is an image of your lungs may be revealed an abnormal mass or nodule. So it is very important to use for assessment. So next is the computed tomography or the CT scan. It also in some cases that very accurately shows tumor extent within and predicts spread beyond the lungs. Next is the positron emission tomography or the PET scan. So this is the most accurate tools for determining whether the cancer treatments destroy cancer cells or if the cells are spreading to other parts of the body and whether cancer has recurred after the surgery or other medicines. So next is the sputum cytology. It is a routine examination and or screening method for detecting central type of lung carcinoma or such as squamous and small cell carcinoma. Next is the biopsy. Biopsy is very important that it can help to determine if you have cancer or another condition. Next is the TNM or the tumor node or metastasis. So this staging system for lung cancer is an internationally accepted system that used to characterize the extent of the disease. So the TNM system combines the features of tumor into stage groups that correlate with prognosis and are linked to treatment recommendation. Lastly, we have here the pulmonary function test or the PFT. It is a non-invasive test that shows how well the lungs are working. This test measures lung volume, capacity, rates of flow, and gas exchange. So, this information can help your healthcare provider diagnose and decide the treatment of a certain lung disorders. So we have here the medical management. So medical management treatment depends on the cell type, stage of the disease, and patient's physiologic status. So particularly cardiac and pulmonary status. So involves like such as surgery, radiation therapy, chemotherapy, and immunotherapy. So a combination of these, the treatment for patient with small cell lung cancer may include surgery, but only if the cancer is in one lung and there is no metastasis. So, radiation therapy, laser therapy to open airways blocked by tumor growth, and endoscopic stent placement to open an airway. So, next is the treatment. So, for the surgical management of thoracotomy, a creation of a surgical opening into thoracic cavity, a wedge resection to remove a small section of lung that contains the tumor, along with a margin of a healthy tissue. Also, segmental resection to remove a larger portion of lung, but not an entire lobe. Next is the lobectomy to remove the entire lobe of one lung. Also, we have here the pneumonectomy to remove an entire lung. Next is the radiation therapy. It uses high doses of radiation to kill or damage cancer cells, that preventing them from growing and dividing. We have here the conventional EBRT that involves directing radiation beams from outside the body to the tumor. So this treatment is usually given daily over several weeks. Next is we have the IMRT, or the intensity modulated radiation therapy. It allows for more precise targeting of the tumor while minimizing radiation exposure to surrounding healthy tissues. Also, we have here the treatment, uh, the chemotherapy, often a combination of multiple medication designed to stop cancer cells from growing. So, chemotherapy for lung cancer is usually given through an IV. So, chemotherapy is often used after surgery to kill any cancer cells that may remain. It can be also used alone or combined with radiation therapy. Also, chemotherapy may also be used before surgery to shrink cancer and make them easier to remove. Also, here we have immunotherapy that reveals cancer cells to your immune system so your own body can fight cancer. Also, agent targets programmed cells, that proteins such as PD-1 or PDL1 on T cells that prevent T cells from attacking other cells in the body. So the FDA approved the checkpoint inhibitors are pembrolizumab and nivolumab, atezolizumab, and durvalumab. So they are delivered by IV infusion every 2, 3, or 4 weeks over several months or up to 1 year. So we have here the prevention and control. So quitting smoking is very important, such as quitting reduces the risk of lung cancer, even if you have smoking for years. So dili jud dali-dali nga makakwit, but important kay ni siya para dili ta magadevelop og lung cancer in the future. Also avoid secondhand smoke. When you inhale secondhand smoke, you're breathing in a lot of the chemicals from cigarette. So ikaw mismo ang mas maapektuhan kaysa sa naninigarilyo. So it's very important nga mulayo ta nya ato pod sila istoryahan tong katong mga nagarilyo, especially sa to mga tiyo or like ato ang papa man ron, nga importante kayo nga layo sila of if mag-smoke sila, so dapat dili sila do labi na sa mga bata or like katong mga hubakon no, kay delikado kay maapektuhan nilang breathing. Like, then also check your home for random gas. So it's a radioactive gas that you can't see or smell. So it is released when uranium in rocks and soil breaks down. Next is know your family history. So both genetic and environmental factors contribute to this increased risk. Also avoid exposure to hazardous substances. So exposure to certain chemicals can raise your risk of bronchoalveolar and bronchoalveolar carcinoma or lung cancer. Also, get regular exercise, because the more you exercise, the more it seems to lower your risk. Next is eat a healthy diet. It is to help to lower the risk and eat a healthy diet with lots of fruits and vegetables, whole grains, and lean protein. Also, lastly, talk to your doctor if for regular screening can help you detect a lung cancer early and it may be easier to treat. However, screening is only recommended for people at a high risk of lung cancer. Next is the nursing management. So nursing management is managing the symptoms. So it's very important for a nurse to educate the patient and the family of the patient about the potential side effects of the specific treatment and strategies to manage them. Also, sa tuwang nursing management natin relieving breathing problems. So we need to encourage the patient to assume positions that promote the lung expansion and to perform breathing exercises for lung expansion and relaxation. Also, patient education about energy conservation and airway clearance techniques must be done. Also, breathing may also relieve with a deep breathing exercises such as chest physiotherapy, directed cough, suctioning, and in some instances, bronchoscopy. Next is reducing the fatigue. So it is commonly experienced by patients with lung cancer and may be related to the disease itself. So the cancer treatment and complications, sleep disturbances, pain and discomfort, hypoxemia, poor nutrition, or the psychological ramifications of the disease. Also, for the nursing management, we have here the providing psychological support. Often, the nurse must help the patient and the family to deal with the following. So, the poor prognosis and relatively rapid progression of this disease, also inform decision making regarding the possible treatment option. Next is method to maintain the patient's quality of life during the course of this disease. Also, end of life treatment options. So for the nursing interventions, we have here assessing for the tracheal deviation. So the trachea of the patient should be positioned in the midline of the neck, and also the deviation can indicate tumor growth or fluid accumulation, potentially impacting breathing. Next is administering analgesic as prescribed for pain management. Because lung cancer can cause significant pain, so which can significantly impact the quality of life. And administering pain medication as the doctor prescribes is very crucial for managing pain and improving patient's comfort. Next is placing the patient in a Fowler's position to help ease his or her breathing. So, sitting upright or slightly reclined in a Fowler's position allows for an easier chest expansion and improved breathing, especially for patients with respiratory distress. Also, next, also administering oxygen as prescribed and humidification to moisten and loosen secretions. So, lung cancer can affect oxygen level, so leading to hypoxemia. So administering oxygen as prescribed helps to maintain an adequate oxygen levels and prevent complication, and also humidifying the air can loosen and thin mucus secretions, making them easier to cough up and clear, further improving breathing comfort. Next is monitoring the pulse oximetry, because pulse oximetry is a non-invasive way to monitor oxygen saturation in the blood. So this is very helpful for nurses to use for continuously assess the effectiveness of oxygen therapy and identifying potential changes in oxygen level, allowing for timely intervention if needed. Next is we have here the providing respiratory treatments as prescribed. Providing respiratory treatment as prescribed, these could include nebulizer therapy, which medications like albuterol to open airways, chest physiotherapy to loosen and mobilize secretions. Also, we have here administering bronchodilators and corticosteroids as prescribed to decrease bronchospasm, inflammation, and edema. Bronchodilators relax and open airways, while corticosteroids reduce inflammation and swelling in the airways. Next is providing a high calorie, high protein, and high vitamin diet. So this lung cancer can cause and lead to malnutrition and weight loss of a patient. So a calorie-rich diet with adequate protein and vitamin helps maintain an energy level that support the muscle mass and boost the immune system for fighting infection. So nurses can provide a dietary counseling of the patient and support ensure patient that receives the necessary nutrients to support their health and treatment journey. Next is providing activity as tolerated, such as rest periods and active and passive range of motion. Balancing activity with adequate rest is crucial for lung cancer patients. Lastly, monitoring for bleeding infection and electrolyte imbalances. So lung cancer patients are at higher risk for bleeding, infections, and electrolyte imbalances. So nurses monitor vital signs, laboratory results, and clinical signs for this. So we have here the gerontologic consideration. So number one is increased incidence with age. So lung cancer incidence increase with age and the majority of cases are diagnosed in individuals over 65 years old. Comorbidity and functional status. Current conditions can impact treatment decisions and overall prognosis. Third is the symptoms recognition and communication. For elderly individuals may be less likely to report symptoms or may attribute them to aging. Next is diagnostic challenges. Older adults may face challenges in undergoing certain diagnostic procedures due to comorbidities, frailty, or cognitive impairments. Next is treatment decision making. Because treatment decision making in older adults should be individualized, taking into account factors such as overall health, comorbidities, and patient preferences. Next is physiological changes and drug metabolism. So aging is associated with physiological changes that including decreased organ function and altered drug metabolism. So lastly is the supportive care and palliative medicine. So palliative care plays a significant role in the management of bronchogenic carcinoma in older adults. So focusing on symptoms management, psychosocial support, and enhancing quality of life, this approach is particularly important for those who may not be suitable candidates for aggressive treatment. And here is our references. Thank you for listening, everyone, and have a good day.